Hello, everyone. This is Dr. Kim, and I would like to discuss a case where the patient was diagnosed with residual cyst, um, and this was taken out about 2 years ago, and I want to compare the pre-op and post-op scans. Let me go ahead and turn on the crosshairs. And as you can see, I'm going to point your direction to this part right here, posterior left mandible. There are actually a lot more interesting things to talk about in this scan, but hydroxyapatite, by the way, um, it, let's just focus on the cyst that we see in the posterior mandible. As I have conveniently traced the mandibular canal as well as how the mental foramen exits or is located in this direction, you can see that there is a very well-defined corrugated radiolucency in this area, and which has actually inferiorly displaced the mandibular canal. So the only way to show you that is to hide this. Okay, so here you can see that this canal has been displaced inferiorly. And as we look through this cross-sectional image or the coronal sections, you can see that the lesion not only has displaced inferiorly up against the cortical plate or the cortical bone of the mandible, but the canal corrucation is also not very well visualized. Um, by the way, this granular heterogeneous radial opacities that are sitting on top of the residual ridge, it is a very unique material that is no longer used in the clinical settings anymore. But I've been informed from talking to the oral surgeon that hydroxyapatite was used as a choice of graft material several decades ago. And that was only during for a few years, and then they stopped using it. And you can see that this graft material, even after several decades later, it never really, I guess you could say it's blending with the bone, but it hasn't integrated with the bone the way that normal graft material would. It's simply sitting on top of the bone um, in this area, and that they could, if they were to go in surgically, you can just go in and surgically just kind of scrape off much of this material. Um, but you can see in some ways, yes, it did integrate, but that's really another, I feel like, a video to just to even go over that feature. But I just thought it was just really interesting the way that this shows up. This particular graft material showed up on the scan. And again, so this was taken out. And let me show you the scan that was taken 2 years later. And then let's go back to that exact same area. So thankfully, as far as I can tell, that cyst is no longer visible. We still see the deflected nature of the course of the canal, but clearly we don't see a large radiolucency that was present in this area. However, what we see instead is that there is a kind of osseous defect that extends kind of centrally, really where the, I think, center of the lesion was. And you can see that is entirely corrugated now. And if we were to see that in the sagittal view, that's the nature of the defect or the extent of the defect that we currently see. And given that the surgery was done 2 years ago, I personally, I don't see that as a overt evidence of recurrent or residual cyst, persistent cyst. And we know that the residual cyst, unlike OKC, odontogenic keratocysts, if it's fully taken out, they are not known to recur frequently. So as far as how I would interpret this, I see that as an osseous defect from the surgery, but the surgery itself seem successful, and I don't see recurrent cyst. Anyway, I thought this is a very interesting case to share with you. And just as a final kind of note, maybe I can quickly go over the overall extent of the hydroxyapatite that was placed. You can still see some granular separated hydroxyapatite materials away from the ridge or along the crest, and that here as well. Yeah, anyway, and it even kind of got to the area over the mental foramen as well. And I was initially curious as to whether the patient had any symptoms because of the material right around the mental foramen. But as far as I know, patient is asymptomatic. Anyway, thank you so much. I hope you found this video very interesting, and I'll see you next time.